Okay, hi everybody. Hello, I think we're going to make a start. Those of you who are near the back, you might want to come further forward because there are actually some flyers on the chairs further forwards, which you're not going to get if you're near the back. So please come further forward. So welcome. My name is Marian Fixler. I'm not sure if what the situation was with Kevin didn't mention whether he was going to come in, so I think I'll kind of just introduce myself. My name is Marian Fixler. I'm an acupuncturist, and I practice specifically Japanese acupuncture, having come from original training in TCM. I'll be referring to sort of the different styles of Japanese acupuncture that I do, but I just wanted to point out, and maybe this wasn't kind of made clear in the talk, that I'm really going to try and make this talk relevant to all of you, whatever styles of acupuncture that you do. So there isn't a kind of prerequisite that you have any kind of knowledge or understanding of Japanese acupuncture. So welcome, and it's nice to see lots of familiar faces and also lots of new faces. And as you can see from the title, it's slightly kind of ambitious. On the one hand, an hour and a half is a long time to speak, and on the other hand, it's kind of quite a large topic. So I'm going to be sort of really just doing a kind of overview. So what I really wanted to kind of point out is that I'm not doing a kind of how-to of how to treat in these stages, but really giving you some pointers of things that you can kind of consider about what kind of goes on in these sort of different stages that you can apply, particularly a sort of certain model that I'm going to talk about, how you can apply that within all the different sort of styles of acupuncture that you do. So in terms of looking at the sort of stages of life, those of you who came to Hamid's talk earlier today, he talked quite a lot about transition points and about times when there's kind of change and about how we adjust to those sort of different sort of times in life. And the changes that go on, and I'm sort of looking at those kind of areas down the bottom there, we're looking at often, if you think about internal as well as external changes. So in internal changes, there's sort of things that will often make us feel maybe uncomfortable, where we're sort of not feeling like we're familiar with how our body's changing, that we're kind of having to adjust to sort of unfamiliar changes. But also times where it's about how we interact with the external environment and how do we adjust to that as well. And also the sort of challenges of that. And I think we all appreciate that change generally is quite challenging, and that we all kind of grapple with it and are often quite resistant to it. And certainly in terms of things like spiritual practices, it's very much, Hamid talked about being kind of in present time and about how do we kind of feel comfortable with where we are in present time rather than either being in the past or thinking about the future. So I've picked some kind of topics here, particularly in regard to sort of babies, toddlers, children, teenagers. Obviously it's a big sort of time of change, and often kind of very visible changes. You'll see that I then kind of move to sort of pregnancy and menopause, and you might be thinking, that's all very kind of female related, and where are the men in all of this? And I think this is more about me focusing on what are the kind of, who comes to my practice, and the fact that predominantly, even though I do treat men, most of my patients are women. So I would invite you, through all the things that I talk about, to think about, again, your particular groups of patients that you treat and how it might relate to that. So I cover also the elderly, but for example, I've left out things like end of life. So again, those of you who maybe work in hospice settings or work a lot with people who are terminally ill, again, it's just thinking about that and applying it in those contexts. I used to work many years ago in the HIV field before the advent of antiretrovirals, when people were dying quite regularly. But as I say, in terms of my current practice, that's kind of what I'm sort of drawing on here. So again, very kind of theoretical, and I'm only drawing on the 7-year cycles of life rather than, also as you'd be familiar with, they're all the 8-year cycles. And Sue in chapter 1 describes these in a kind of quite a formalistic way, and as Hamid mentioned this morning, obviously some of these are not so kind of relevant in the sense that everything's changing and changing in our society, and things happen much, much sooner and much earlier. But what you'll see in that is that generally the emphasis is very much on kidney qi and what happens in terms of the development of the kidney qi, what happens in terms of that kind of coming into full maturation around the age of 28, and then how that already starts to decline from the age of 35. So there's a lot of emphasis on teeth and a lot of emphasis on bones, and no mention at all, actually, of the other Zhang Fu in that chapter. Well, those of you who work in the area of fertility, that kind of fits in really with what we're told in terms of the decline of fertility around that time. So we kind of think that's kind of quite young, but already it talks about the face beginning to wrinkle and hair beginning to fall. So it's all kind of very heartening stuff. I don't know how many of you work maybe with other cycles, but the other things that also to consider are the circadian rhythms, the 24-hour clock that we know that the qi flows through the different meridians over a 24-hour cycle. And certainly in the styles of acupuncture that I use, those are actually applied in a very kind of practical way in terms of thinking about how we may use the circadian rhythms. Also the lunar cycle and menstruation and how that impacts on women, and then also traveling and things like that can also disrupt the menstrual cycle. And of course then the seasonal cycles and how that is affecting us. And we're going, say for example, now we've got kind of Indian summer, but moving also into autumn and into from sort of earth to metal, and sort of seeing how that kind of resistance to that change and the difficulty, and people saying, oh, I really hate autumn, or it's so sad, the summer is over, and that kind of the letting go and moving on. So bearing those kind of things in mind when we're looking at how we move through those sort of cycles, I'm just going to introduce very briefly I'm not going to really talk about the actual systems, but I'm just going to put it up there. I mainly practice using two styles of Japanese acupuncture. For those of you who are not familiar with Japanese acupuncture, if you say Japanese acupuncture, it doesn't mean any one thing. There are lots and lots of styles of acupuncture. Things were never formalized the way they were in China. Politically, things were much more, it was kind of much more fluid and much more flexible. So there are lots and lots of named systems within Japan, and I'll certainly point out some of the things that maybe some of them have in common and how that also relates to the model that I'm going to give you for today. But just to say, Dr. Manaka actually is very relevant for this conference theme, because he developed a whole sort of system of using the 8 extraordinary vessels as a kind of topography of basically showing them how they present on the body, and particularly how they relate to various kind of cross sections and quadrants on the body, as a way of identifying areas of imbalance, and by correcting those using the 8 extraordinary vessels. And Dr. Manaka was both a medical doctor, he was an acupuncturist, he was a mathematician and a scientist, and brought lots and lots of, he was a bit of a magpie and brought lots of things into his style of treatment. Toyohari meridian therapy, I'll be referring to a little bit more because it is the main kind of way I work, is basically a branch of meridian therapy that uses the 5-phase cycle. So it's not 5-element acupuncture, but it uses 5-phase theory, and was specifically developed for blind practitioners, which there's been a long tradition of blind practitioners in Japan who often weren't allowed to practice in other professions, and also things like anma massage was a big thing in Japan. So the whole thing around touch and palpation has developed as a really big thing through that. And in the 30s, the Toyohari Meridian Therapy Association was formed, and Kodo Fukushima was like the first president of that association. So in terms of how some of these sort of general characteristics are relevant in terms of looking at these different stages of life. One of the key things is that treatment is very structured and very systematic, in the sense that there's a kind of beginning, middle and end to a treatment, and you kind of basically build on the treatment depending on what you're finding, depending on what you're feeling through palpation, what you're feeling on the abdomen, what you're feeling on the pulse. So it may be a slightly different way of understanding root treatment and branch treatment. Those of you who are coming more from a TCM background will be familiar with the terms of the Ben and the Biao. In Japanese, it's called the Honchiho and the Hyochiho. But we talk about root treatment as finding what are the fundamental imbalances within the meridian system that need to be corrected. And by doing that, we're trying to bring the channels and therefore also the effect on the underlying organs into some kind of homeostasis. So it's about regulating the qi through the meridians and bringing things back into a more ordered state. Branch treatment, on the other hand, is more about an understanding of working on symptoms, and particularly like the presenting complaint, and finding the range of different options that we can use in order to address that. So in Japan, there's a lot of specialist practice in things like moxibustion. There are moxibustion specialists who only treat their patients with moxa. There's cupping and there's bloodletting, and then there's a whole range of other things. And you might think about other things that you use in your practice, things like press tacks, ear needles, all those sorts of things. I'd say one of the key characteristics of Japanese acupuncture that probably covers all of the different styles of acupuncture is abdominal diagnosis. So this kind of, although is there in the classics in terms of the mapping of the organs and how they're presented on the abdomen, it isn't used so much in Chinese styles of acupuncture, although I know it's used in things like in Kampo herbal medicine, but again, that's coming more from a Japanese tradition based on the Shanghan Lun. But certainly, again, the influence of blind practitioners, and often, therefore, particularly in Toyohari, they're using very, very light touch. You're really feeling about what's happening at the surface in terms of feeling for the quality of the qi. Needling tends to be very shallow, and certainly anybody who studies these styles of acupuncture, if you're coming from say a TCM background, it can be very challenging. Certainly in Toyohari, often we don't insert the needles at all, but we're doing very kind of quite complex needling techniques that involve at least a minimum of a year training to even get the basics. And through that, we're actually using both silver needles and stainless needles. There are 2 different styles of tonification techniques and at least 6 or 7 styles of dispersion techniques. So although, you know, I have sort of people sometimes disparagingly say, oh, does that mean you just wave the needle over the point? The actual style of treatment is actually, again, kind of following classics around the direction of needling, the depth of needling, and lots of other considerations when it comes to deciding which points to use and how to needle them. But either we're needling using non-insertive techniques, or we're needling using maybe 1 or 2 millimeter insertion, and usually no dirty sensation. So we're also looking a lot of the time for feedback from patients, telling us there and then what it is they're feeling, and also feedback when we're feeling the abdomen about how that's changing. So this sort of dynamic approach in terms of feedback, what is it we're actually looking for? We're actually, as I say, this step-by-step approach means that you can literally, you're looking to see how is the pulse quality changing after each point that you needle. And that also informs us as to how and which points to needle next. So you may have an overall diagnosis, but that also is going to be adjusted depending on how the patient is responding to treatment. So there's a kind of literally this step-by-step approach. We're looking for improvement to the luster, and this may be about abdominal changes after needling, but also on the channels. When we think about luster, usually we kind of think about something that you see. but when the blind practitioners talk about luster, they talk about something that you can feel. So it may be something that I invite you to do with your patients, just as a way of starting to monitor some of these things that you can use, even if they're not part of your style of diagnosis, where you can literally just start to kind of feel, how do the channels feel on the patient when they're lying down. Not necessarily looking at the different channels in relation to the different meridians, but just the overall quality of the skin. Does it feel kind of particularly a little bit loose? Is it very taut? Does it feel very dry? Is there any kind of moistness there? So just kind of starting to get a feel of just what's going on the skin surface. Looking at also things like complexion, so a patient who's lying down who might be very flushed, ideally you'd like that flushing to settle down. Or conversely, if somebody's looking quite normal and starts to flush, then that's obviously not a very good sign at all. So kind of paying attention to that. But also again, luster, somebody can start off coming into the treatment room with the skin looking quite dull, and then it starts to kind of get a little bit more luster, and that's looking rather than obviously the touching. Something to pay attention to, again, that we can all do is just looking at the overall. We're all aiming for our patients to start to relax, to start to have a sense of well-being, to maybe release some of that stress whilst they're on the treatment table, and obviously looking to see what's going on with the breath and how that's changing. So these are things that you can all be applying, and maybe you are doing already, but they're kind of indicators of how somebody's responding to treatment. Other changes are the relief of symptoms, that somebody might actually start there and then to feel changes in the treatment room, and often that's quite a good sign if we can have that, but it doesn't always happen. But also, again, maybe the converse of that if suddenly there are symptoms developing whilst they're on the treatment table, and I'll talk about that in a little bit. Again, we're often looking, and again, you can be doing this as well yourself, is looking for what changes either on the skin in terms of the skin quality, or when you're doing abdominal diagnosis, then you're specifically looking for changes in the abdominal wall. So in the Manica system, you're specifically looking when you put the 8 extravessel the relevant pattern, and you've put something called the ion pumping cords on to connect those up. Within 30 seconds, that abdomen should start to change and to release. And if it doesn't, then you need to do certain adjustments to that. So these are kind of changes that you can evaluate there and then in the treatment room. And also patient feedback throughout. So people will often tell you things that are going on that give you an indicator of how they're responding to treatment. So the kind of main overall, the model that I kind of want to look at is really looking at the subject of dosage. And I don't know about you, but certainly when I was at acupuncture school, and since, dosage isn't really a topic that's talked about. It's certainly talked about in Western medicine, depending on, if somebody's put on medication, what the dosage, how many drugs, how many pills they have to take in a day, how many times they have to take it. Those of you who are herbalists obviously are going to be applying issues of dosage on the prescription that you give your patients, how many, what weight of each herb that you will put into a formula. But certainly in acupuncture, it's not talked about very much. So if you have a look at some of those quotes, and also the quote from Ling Shu 7, it's interesting that in the Toyohari Association, there's a lot of talk about how treatment can go wrong and how can we adjust that and how can we stop that happening. So people are very kind of frank and very honest, and there are lectures on how, what constitutes a mistaken treatment and how do you correct that. So again, that's kind of quite refreshing, because often, these things happen in our practice, and they can happen even when you're very experienced, but it's not something that's talked about very much. So looking at the quote from Ling Shu chapter 7, it's really talking about how do we adjust what we do based on the illness, and also, to do with what's going on in terms of the qi. So it's talking very much in that first sentence about, well, it talks particularly about, the length of the size of the needle, and how you can maybe do too much dispersion and cause an illness to deteriorate. or if the needle is too small, and that may also be in relation to the depth of the needling. So it's talking about their needle gauge and also depth. So I don't know if any of you, like in your practices, whether you have a whole range of needles. Obviously for certain conditions you're going to want to go in deeply, so you're going to have a longer needle, but whether you change the gauge, for example, of your needle depending on who you needle. Are you needling with a number 1 needle, number 2, number 3, depending on kind of what you're picking up, either on the pulse or different things. So I'm throwing these things out there, and as I say, I'm not saying that you're not doing this already, but it's kind of interesting to consider how you can apply it. So there's something called the Goldilocks zone, a term that was actually coined, I think, from astronomy, that is looking at the planets, particularly in relation to the sun, and where they are in relation to either being too close or too far, whether it's too hot or too cold. And you all know the Goldilocks story, where she went into the house with 3 bears and tested out their bed, and I think their chairs and their porridge and everything else, to see one was too big, one was too small, one was just right. And my colleague and friend Oren Kaviti has written an article based on this kind of model in the North American Journal of Oriental Medicine, and I'm going to be kind of expanding on that for you as part of the kind of overall model to think about, again, how we treat at these different stages. So what it does, he talks again about this idea of, how can we get the maximum effect from the minimum amount of treatment? What is it that we can do that tips that balance to bring about a therapeutic effect and get improvement in our patients without doing too much? So anything that allows you to do in a step-by-step way so that you have more control, giving you time basically to assess these things, will be a way of trying to avoid either wrong treatment or over treatment. And in terms of how we evaluate dosage, I talked earlier about the skin quality and luster, and that's something that you can all do. You don't have to be using it the way that maybe I use it diagnostically, but you can literally just touch your patients in ways other than feeling the pulse, for example, or identifying where the acupuncture point is. You can literally just touch the patient's skin, just see how it feels. Looking at the pulse, does it match the symptoms, how the patients present? How often do you get somebody, I've had somebody recently in my practice, really strong man, very good muscles, lies on the table, almost imperceptible pulse. There's a kind of imbalance there somehow between kind of yin and yang and what you expect. There's a kind of inconsistency. So thinking about those when you're thinking about what it is you're doing. Listening also to the patient's voice and their story, and again, how are they kind of projecting that chi? Is there the kind of strength behind the voice? And what it is, how they're reacting to what they're saying. Is there a kind of consistency there? So I guess what I'm inviting or kind of bringing out is this idea that one can constantly be assessing what it is we do, and we're assessing it within the course of the treatment, but also the importance of evaluating that each time somebody comes into your treatment room. So somebody who 1 week is feeling much, is quite robust, might next week come in having had very stressful week. Maybe they're not sleeping very well. It may be that just that day they've had a really, really stressful day. And how do we kind of adjust what we do to bear that in mind? Also, people who've maybe had a lot of acupuncture maybe are more sensitive than when they first came for treatment. So again, we may actually end up doing less with people that we've been treating for a while rather than more. So the model I'm going to show you, it's Manika's model that talks about adjusting and understanding dose before and during treatment. So it's a little bit kind of, it's a graph, and it's kind of thinking about how do we, apply this in a sort of therapeutic situation. So here on the vertical line, you've got the dose of treatment, the amount that we're actually doing within any treatment session, and on the bottom line, we've got the time. So the first line is what's called the TDT, which is the therapeutic dose of treatment. And this means it's like, what do we need to do in order to get some kind of positive effect and some kind of positive change in our patients? And the MDT is the maximum dose of treatment. So the idea being that if you're treating around this area, you're not doing enough to bring about a change. If you're in this zone, you're going to bring about a positive change. But if you go step over that, it's going to be too much dose of treatment. So giving the example of that first line, why, you might be thinking about something that's kind of quite strong stimulation. So can you think of something that you would regard as strong stimulation? Just throw it out there. Reduction technique, anything else? What would you regard as a strong stimulation in your practice? Don't necessarily mean just acupuncture, other things that you do. Gua sha, okay, anything else? Maybe moxa, maybe, depending on how much. I'm thinking of things like bloodletting, or maybe strong cupping, or maybe electroacupuncture. Just throwing it out there. So, I'm not very mathematical theorist, so I hope I can explain this properly. But basically what you've got here is Y1 is when you reach that point of therapeutic dose, and Y2 is when you reach the maximum. And T1 is the kind of line that gives you a sort of idea of the time it takes to get from one to the other. So if you think about something that's maybe more gentle dose of treatment, again, can you think of something? Maybe moxa, okay. Anything else? Silence. So maybe just more lighter treatment, maybe just, sorry? Thinner needles, maybe not doing so much stimulation on the point if you do dirty sensation, whatever. Sorry? Fewer points. Yeah, exactly. So then you can see what happens. You get a sense of this, that it takes you longer to get from the therapeutic dose to the maximum dose of treatment. Okay? So to give you an example, I mean, this is stuck in my head because it happened a very, very long time ago, quite early on in my practice, and it was before I was doing Japanese acupuncture, and it was before I would automatically check, say, for example, the neck area to see the quality of the skin and what's happening with the quality of the muscles. But I had a male patient actually coming for treatment. I can't remember even what he came for, but he was actually kind of quite, seemed to be sort of reasonably in good health. I think he came for, I'm not sure if it was necessarily actually for musculoskeletal problems, but basically he was probably, I think, in his 30s, gave him a treatment, ready to get up off the table, classic, oh, I forgot to mention, I've got neck problems. My neck's really, really tight. Have you got time? Is there something that you could do just to help my neck? And being, you know, very kind of enthusiastic, not so long qualified practitioner, I thought, okay, I could just quickly put some cups on. So he's sitting there, pop the cups on. Of course, gallbladder 21 area was really, really tight. What does he do? Boom, off he goes straight, luckily on the table, but faints there and then. And I'd never seen anyone faint at all in my life, never mind in my treatment room. So I was absolutely terrified, although I remembered all the things that you're supposed to do when somebody does faint, and I took the cups off. By then, I think the needles were out anyway. And actually, he came around pretty quickly, and I was trying to stay very, very calm. But when he came around, he said, you sounded really scared, you know. And of course, I was trying to be really kind of professional and calm with the whole thing. So for me, that's an example. You could say, well, you know, if you're going to do cups on somebody sitting, that's a pretty, you know, kind of common thing that might happen. But I also reflected on that and saw it was that classic thing of doing too much, you know, and that thing of trying to please our patients. So that was, and he wasn't particularly sensitive, but obviously what I did at the end took him over into the excessive dose of treatment. So this is just to invite you to kind of think about, this is sort of before we get on to the specific areas, but just thinking about who comes into these categories. Now, obviously, this is kind of quite general, but it gives you kind of quite a good idea. So people who are what we call normally sensitive, where it's not necessarily an extreme sensitivity, but where you should automatically be thinking, what am I doing here with this patient? So somebody who's either particularly elderly or young, somebody who's got psycho-emotional problems, maybe who's had some kind of emotional trauma, people who've been ill for a long time, who haven't slept, maybe they've been traveling and maybe even short-term not slept well because of jet lag, people who are shift workers where their whole circadian rhythms are often disturbed, people who do a lot of caring for other people. People who just generally come into the treatment room and look maybe quite deficient. You know, you can often just see it on somebody when they come into the treatment room. And also all the people who are doing a lot of energetic work, which probably includes everybody in this room. People who are practitioners, who work with their own chi, people who've done maybe a lot of therapy, people who are more creative, that kind of thing. People who, I mean, you get people who sometimes literally come in and they say, oh, you know, I'm very sensitive. They already know that from other treatments that they've had. So that kind of gets you little alarm bells ringing. People who are hypersensitive, people who maybe really kind of, you have to be super careful with babies and toddlers, people who are quite neurotic, people who've got chronic fatigue, maybe where there's a viral component, people with things like fibromyalgia, a lot of inflammatory type conditions where it doesn't take much to tip somebody over and get an adverse reaction to treatment. And then on the other side, you've got people who are less sensitive, who maybe are chronic patients but who've plateaued and are just not responding much to treatment at all. Or maybe elderly patients who are maybe they've got more of an excess type condition, whereas more kind of maybe blood stasis rather than them being very depleted. And people who do a lot of manual and physical work who maybe are quite resilient because of being exposed in terms of their external environment. So this is the same chart that we had, but adjusted to the sensitive patient. So now, as you can see, therapeutic dose of treatment kicks in much earlier. It means you don't have to do very much in order to reach that therapeutic dose of treatment. The second line is also quite low, which means you have to be even more careful because you've got very little leeway there between bringing about a good effect and it kicking over into being too much treatment. So if you think about that first type of treatment that you did, maybe your bloodletting or your electroacupuncture or a lot of cups, for example, you can see that that time in which it takes for there to be an adverse reaction or to go over happens much sooner. And the same with the second line as well. You've got a little bit more time, but still it's going to kick in a lot sooner. What you ideally like, the patients that we all love to treat, are the ones where they respond really quickly to treatment, but that second line is up here somewhere. So actually you've got and you think, oh my God, I'm such an amazing acupuncturist because, you know, I've basically haven't had to do very much, and look, they've got immediately better. They're probably the patients who actually have got a much bigger zone between the therapeutic dose and the maximum dose. So with these patients, you're really thinking about bringing down what you do even less. So it may be just really, you know, tiny amounts of treatment and adjust and see how they are. I was talking to a colleague this week, and I was talking to her about the talk I was giving, and she was saying, you know, she said, oh God, yes, I've had somebody in my practice literally just today, and she said, I think I over-treated them because they came in, they had ME, turned out they hadn't eaten very much that day, they hadn't slept very well that night, and, you know, she explained what she did on the front, and then she said, I turned them over, and then I started working on their back, and then they suddenly said, oh, I'm not feeling very well, I'm starting to feel a bit sick. She said, I think it was over-treatment. So, you know, even experienced practitioners, it can happen too very easily. So it's thinking about making those just incremental changes and assessing as we go along. So you can see you've got more time there to change that. So, what do we do? Somebody already mentioned that. How can we change, for example, with our root treatment? What do we do? It may be to do with the number of points and how long you retain your needles. Something's gone a bit funny there. It may be that you look at your length of needle and what gauge. You might want to think about using a thinner needle, for example, with certain patients. In Toyohari, we think about what metal we use. When we're doing tonification on the root pattern, we usually use a silver needle. And more for dispersion techniques, we use a stainless steel needle because it's firmer and you can manipulate the needle more easily. But if you've got somebody who's more deficient and you're doing dispersion on a yin meridian, on the second secondary, what we call, not on the primary pattern, but on the secondary pattern, it may be that we think, actually, I'm going to use a silver needle to disperse rather than a stainless steel needle as a way of bringing down my dose of treatment. Also on Toyohari, we only ever needle one side of the body for like the primary pattern, and for then on the what we call the engendering cycle, and then on the controlling cycle we needle on the other side. So that's a very sort of specific approach to Toyohari, but it may be that you always do bilateral needling, but maybe you don't need to, and you can think about, well, actually it may be appropriate to do needles, some on one side, some on the other, as a way of reducing dose of treatment. How deep you needle, again, what the appropriate depth of needle might be. Certainly in Toyohari, that's decided based on what you're feeling on the pulse. If you've got a deep pulse, then you're going to needle more deeply into the chi field. If somebody's got a more floating pulse, then you're going to needle more superficially. And then again, the overall amount of tonification versus the amount of dispersion you'll be thinking about. If you're looking at moxa, you might want to think, we use a lot of direct moxa, like what's called half rice grain, oku moxa. So you might want to think about how many points you're going to use, or how many cones you're going to use on each point. We can start off with as little as 1 cone, or you may go up to 3 or 5 cones, for example. If you're using cupping, you might want to think about the number of cups, how strong the suction is, how long it's retained. I use pump mechanism because you can really control how strong your suction is. When I used to use fire cupping, which I was originally taught at acupuncture school, you go like that and go, and it just goes on, and it's often really, really strong and immediately goes dark, purple or whatever. You can actually adjust with a pump mechanism. You may only actually use one little small pump rather than a full pump action, or maybe you just do 2 or 3, or just like literally 1. So you can adjust all of those things. And microbleeding or bloodletting, if you use that, again, you can think about how many points you do. And ideally, if you're doing something like Jingwell points, the blood isn't gushing out, but you're actually doing what we call a kind of milking mechanism, where you literally just squeeze drops of blood out of the point. So then you can really control, maybe I just need to squeeze 1 point out of it as opposed to 2 or 3 or more. So I'd like you to spend just literally a couple of minutes, turn to somebody, maybe somebody who you don't know, somebody who's next to you, somebody who's behind you, and just spend a couple of minutes talking about how do you in your practice get a sense of when enough is enough, or if you think about situations where you've tipped over into over-treatment, what was it that caused that? Okay, I apologize. I know this is not a definitive list of styles of acupuncture. I just put that out there as a kind of range. But I'd like you to just spend literally a couple of minutes now just turning to somebody and coming up with your own thoughts about it. So if we could come back to the big group, and maybe if you just throw out some ideas of what you came up with, be nice to hear. Just
when the pulse becomes deficient.
When the pulse becomes deficient. So you mean when there's been an improvement and then suddenly it weakens? Exactly. So we're looking often, like we often look at that idea of consolidation, that the pulse gets stronger if it's weak. If it's very deep, it maybe comes up. If it's been very rapid, that it slows down. And you can get a good change, and then suddenly what you're describing is it changes, and you've kind of lost that. And you think, oh, it was so good, what happened? Okay, great. Anything else? Don't hold back. Skin becomes a bit damp, yeah. So that's why I encourage you, whatever style of acupuncture that you do, these are things that you can be checking all the time. You can be kind of making contact. And actually, people love having their neck touched and felt very, very lightly. So that's a kind of good sign. Okay, anything else?
Tiredness after treatment, real tiredness.
Real tiredness after treatment. Okay, good. I'm going to go through some of these in a minute, yeah. You mean like as soon as they get off the table, or?
When they come back to the next time and they say, oh, I was really wiped out after
Yeah.
that treatment.
Okay.
That's more.
Yeah. So yes, if somebody says, oh God, I needed to go home and sleep for a couple of hours, and you think, yeah, that's great. They kind of gave into it, and maybe that's really actually going to help their treatment. But if they say, God, I was wiped out for days, that's an indicator that that's kind of too much treatment. Good. Anything else? Must have come up with something.
I used to say, I used to chat to him how he had shoulder pain, big muscular bone, and he did faint, and I held on to him, and I know he never admitted to me that he fainted. I just went, oh, it's a bit wobbly there, oh, it's a bit wobbly there. But, and he didn't, it was really funny because he didn't completely help. But his shoulder pain, it was like it washed away, really. It really was a very powerful treatment.
Yeah.
Actually, he could cope with.
Yeah.
So,
Yeah. So yes, that's a difficult balance, isn't it? It's like your patients fainted and they got better. So is that a good thing or not such a good thing? Or could you have got to that same effect without the fainting bit, for example?
he never admitted he actually fainted.
Sorry?
He never admitted he actually fainted.
Oh, right. Maybe he wasn't aware of it. He just kind of...
Yeah, I don't think you were quite
Yeah.
well.
Yeah. But I mean, I remember going, I don't know quite, I remember going once to sort of just one of the, somebody had recommended actually just one of the Chinese acupuncture places nearby because they said, oh, there's a person who does really, really wonderful tweenar, and I had a shoulder problem at the time. And I felt absolutely awful at the end of that treatment because it was way too strong and I felt sick for the rest of the day. And I went back the next week and I said, actually, you know, I felt really sick at the end of the day, can you just maybe do a little bit less? And they did exactly the same and I had exactly the same reaction. So I thought, well, I'm not going back there again, you know, it's like just listening to what our patients are telling us. Anything else? A couple more ideas, there must be more. Marian.
I think patients can change. I remember having a patient a few years ago that had acupuncture from someone else, different style of acupuncture. As you know, I do Japanese style, and was always, you know, was just floored for several days after the treatment she was having. Came to see me, and bearing that in mind, I did very light treatments. But she's been coming to see me for 2 or 3 years now, and I now find that I can do more on. She's got stronger.
Yeah.
So what? You know, if I was doing a manica style treatment, 6 or 7 minutes would be her maximum, really. And now I can do 2 minutes, do something else as well. And her chi has got much stronger in that process of treatment. And essentially become less sensitive.
Right, okay, so the opposite, yeah, so rather than one of these people
She
who's...
doesn't take any medication at all.
Yeah, yeah.
The medics have given up on giving up because she
Yes.
always completely overreacts.
Yeah.
So
Yeah.
it's interesting
Yeah.
how she's energetically she's got stronger.
Yeah. And ironically, I mean, there are people who, for example, certainly in my experience, people who actually, you know, they come for something like Toyohari treatment where you're not inserting the needle, and actually their reaction to treatment is much stronger than where you go and tap a needle in somewhere and, you know, get kind of either dirty or not get dirty needling. So it's that kind of how you're engaging with the chi and, you know, that, you know, how sensitive somebody is to that. Okay, any last pressing ones that nobody's included?
Well, I remember a very large patient of mine with high blood pressure, and I used an intradermal on him. And which you think is pretty minimalist.
Tiny.
Blew him out of the water. He said within a couple of, he said he couldn't handle it for more than a day.
Yeah.
And it was very interesting that you look at him physically, here's a guy, you know, 6 foot something, used to be a butcher, but has a very sensitive nervous system.
Yeah.
And actually almost the more minimalist you work with him, the stronger his
Yeah.
reaction was.
Yeah. Good. Okay. So thank you for that. And what I've put here, some of those you have already mentioned. So this idea that the skin feeling kind of quite moist or maybe starting to sweat all over. Recognise that? Does anybody on your table look like that? Maybe they felt like that at the end of the treatment. Hopefully not. Getting hot, getting lightheaded. That very classic thing that can happen. Somebody sits up and they go, oh, I feel a bit lightheaded. Is that over-treatment? Maybe. Feeling lethargic, dizzy, nauseous, I would definitely say is over-treatment. Somebody who's been feeling quite relaxed and suddenly they start to feel a bit restless. They're kind of wriggling. They've either been on the table too long or you've done too much. Areas tighten up again that had relaxed, or as you said, pulses that were improving have lost their consolidation or got worse. Needle shock. I don't do dirty needling, but it's talked about a lot, isn't it, in TCM terms. I don't know, how is needle shock explained? What's the explanation of what happens? Fainting or? And what's the explanation as to what needle shock is? Chi moving too quickly. Yeah.
Sometimes after needle shock experience, people feel quite a bit better.
Right.
So I don't know what happens really.
Yeah.
then.
Yeah. Yeah. No, it's always a tricky one, isn't it? But it's often not a very pleasant sensation, isn't it? So it's one to kind of avoid. This is always an interesting one, isn't it? Symptoms it's a healing crisis. We say that a lot, don't we? It's kind of a nice kind of, being quite cynical here, saying it's a bit of a get-out clause. Actually, there is something even in Japanese acupuncture, it's called mengen, which is recognizing that actually somebody might get worse before they get better. And certainly, if somebody gets worse before they get better say within 24 hours, and it's not uncommon, is it, in pain conditions where somebody feels like their pain is a bit worse, and maybe you can make up stories about what that is. Is it about chi moving, about clearing blockages? But then they start to feel a lot better. If they're feeling a lot worse all week, or they develop new symptoms that they didn't have, or those new symptoms develop very soon after your treatment, then I would say that's over-treatment rather than, a kind of, it's like, I would be thinking, what have I done, rather than like, oh, this is just a healing crisis. We've paid a lot of attention to doing too much treatment, but also too little treatment. And I guess it means that somebody's going to take longer to get better. And so somebody who comes back and say, oh, there wasn't really much change. So they didn't have any adverse reactions, but not much happened. Maybe the diagnosis, but it may be that actually you just needed to do more with that person. So Ling Shu chapter 9 talks about failure to needle deeply with somebody who's strong-willed will render the treatment ineffective. So don't take that too literally, but again, it's about how do we adjust what we do that's appropriate for that patient. So, moving on to the specific kind of categories. I'll have to speed up a little bit. So, with babies, there's a quote that basically talks about muscles are weak and fragile, treatment should be superficial and swift. The idea being that both babies and toddlers and very young children, they're very yang. Qi moves very quickly. Pulses, which you're not really going to be able to feel very easily, or you may just get a little sense of with babies, but not in terms of any differential diagnosis, maybe tends to be quite fast, quite floating. But certainly if you have a child whose pulse is very slow, very deep, quite deficient, you're going to be thinking, oh, I really need to be careful here with this person. And skin quality is a wonderful thing to check with babies and young children because it changes very, very quickly. And even at the beginning of the treatment, just getting a sense of what that skin feels like. They sort of talk about ideally a belly feeling like sort of freshly cooked dumplings, for example, that it's quite kind of elastic, quite kind of bouncy. But, you see children, they come into your practice and maybe they're kind of very deficient, and actually they're sort of just the skin feels kind of quite loose, it feels quite weak. You have to really think carefully then about what you do and how much you do. And treatment may only take literally a few minutes. You really don't have to do too much. So I use Shonishin, which you may have heard of or not. There's a flyer on your chairs because we're running a course. Stephen Birch, who's my original main teacher in Japanese acupuncture, is coming over again from Holland in the spring to do a weekend workshop in Shonishin. It's what's called a non-pattern-based root treatment. It's mainly used in young children up to the age of 5. And you're basically working on the whole of the meridian system rather than specific channels. So you're not making a differential diagnosis, but you're doing an overall assessment of the strength and weakness of a child, where the areas are that are feeling more cure, more deficient, or more excess, and treating accordingly. And the main aim and the understanding is that the chi system is still developing. Maybe the specific points haven't fully developed, so although we also often do a very simplified version of a meridian therapy treatment, sometimes we're just doing very, very simple treatment on all of the meridians. There's a range of little sort of tools there, and I'll show you some other ones on the next page. But you're basically doing very light stroking, very light tapping. Where it talks about scraping, it's not gua sha, it's all very, very superficial on the skin surface. And you can also address symptoms, but you're basically working over the whole of the meridian system. Gail, did you want? Yeah, I'm going to go on to that. I'm going to give, some examples of that. So choice of needles, I showed you that little range of all the tools that they've developed in Japan, all these wonderful ones of like tools that you can use for scraping and tapping that look like they're in the shape of a cat or all different things. And you know, usually you have a whole range of tools that you can use depending on the child. This one's called Zanshin and this is an Enshin. They're very lovely silver tools. And again, they can be used to do light tapping, which is a little bit more dispersive, or very light stroking. There's also something that I'm going to be referring to in some of the cases I'm going to describe called a teishin. This is basically a non-inserted needle that has like a little ball at the end. And sometimes the ball can be bigger or it can be smaller. The teishin can be longer, it can be shorter, it can be thinner, it can be thicker. It can be made of silver, gold. People who are really, you know, big magpies about having lots of equipment have 5 metal teishins, they have platinum teishins, you know, you name it, you can kind of get it. But basically, you can make do with 1 or 2. And the only thing is that, for example, gold is seen as to be more tonifying, for example, than silver, and silver's more tonifying than stainless steel. So you probably wouldn't use a gold teishin on a young baby or a child because it's too heating, and children are very kind of yang. When we teach on the Shonishin course, we teach you how to do it with one of those retractable teishins. You know, those ones that are also used, I think they can be used for things like marking points in the ear or something, and they retract. And that's also known as a teishin, and that can be a very sort of simple tool that can be used where you want to specifically needle particular points. So I'm going to go through a few kind of cases really just to sort of describe just a kind of overview of really of, you know, when either the treatment has been effective, doing very little, or when maybe it's tipped over the other way. So this is an example really of a very young baby, 1 month old. She actually mainly came with her mum who was coming for treatment, who I'd treated actually both for fertility and then pregnancy, and then she came back sort of postnatally for treatment and had her baby with her, which often happens. But baby had had constipation and hadn't had a bowel movement for 6 days. She was being breastfed, although it had been topped up with formula because the milk flow had taken time to establish. But generally, she was pretty healthy looking. Her skin had quite good luster. She was a little bit distended in the abdomen overall. There was a little bit of tightness. We also look, I'm not going into all the sort of ways that we diagnose in meridian therapy, but obviously we're using the 4 diagnoses of looking, of touching, listening, asking. So often the forearm here is an area that we look at, and here for colour that also can give you some indication about where imbalance might be. So she was quite white along this sort of area. So this is a lovely example where, you know, she'd started crying, the mum started breastfeeding, and I'm trying to give her a treatment and she's latched onto her mum, what do I do? So that's a perfect example of how sometimes you actually end up doing really very little and you have to work with what's available. So I did some very light stroking on the arms and the legs and the back. We mainly treat on the yang surface apart, so we don't do the yin aspects of the arms and the legs. And even though this is seen as the yin aspect, we do treat on the abdomen. So again, I couldn't really do any stroking along the abdomen, but I was able to do a little bit of light tapping at one point around stomach 25 and clockwise around the navel, and just very light tapping around large intestine 4. I also left in, we often leave in like a little, you know, those little press spheres that are made of gold or silver, tiny, tiny little things. GV12 is a key point for babies and young children for strengthening their immunity. So that's a really nice one to pop on and then give the parents some so that they can kind of change it on a regular basis. So I did diagnose her as a lung pattern based on what I was finding on the abdomen, and I didn't take pulse, but and just her on the symptoms, and did very light tonification on the meridian points for a lung pattern, which was lung 9, spleen 3, and I didn't do a secondary pattern on her with just light treatment. And I showed, because the mum, how to do a little bit of acupressure, bit of tapping also on large intestine 4 at home. So the mum came again a week later, brought baby, bowels had opened that day, and generally had been much more regular that week. I was also treating the mum because obviously the whole thing around, certainly Meridian therapy, it's like we treat the mother to treat the child. We treat in Nanjing 69, that's how we form a pattern. We treat not only the metal point, we treat not only the metal meridian, but also the earth, so lung and spleen. So working on the mum who was kind of quite run down, strengthening her own chi and blood and establishing feeding better. And again, I just did very, very light shonishin, a little bit of tapping around the sort of interscapular and occiput area. And basically, I didn't have to do very much, and the bowel movements sort of settled and regulated. If somebody like that was coming, sometimes people bring a baby for treatment, and literally the treatment can be ready in about 3 minutes or something. And you know, you might be kind of thinking, gosh, how can I even charge for this? But you know, I mean, I've had examples. I was thinking of a neighbour actually who brought her baby for treatment. Actually, no, it was a toddler. This is years ago, and literally the mum was having to kind of hold the child. The child had had recurring ear infections, was kind of at the point where they were like literally banging their head on the floor. Baby, the toddler was kind of quite distressed. Mother was holding her. I just really did hardly anything. And I kind of almost felt like a little bit of a fraud. I thought, like, how can I kind of just send them away with the tiny little bit of treatment I did? And I got kind of, you know, a call later that day saying, you know, the baby kind of just literally went to sleep straight after treatment, woke up and just completely stopped all that kind of banging their head thing. So sometimes you think like you're doing tiny, tiny amounts, but it's enough to treat. And as I say, she was kind of quite healthy, didn't need a lot of treatment. The next case was more complicated in the sense that it's older, and also presenting not only with constipation but also with eczema that had developed at 5 months. There was obviously issues there around feeding and reaction to formula, which the mother had to give because baby was failing to thrive, and actually had put on weight in spite of all the vomiting. And was going to the toilet about once every 2-3 days, and sometimes was straining. So lots of other things going on here. Regularly got colds. They wouldn't clear up very quickly. Quite kind of mucousy, coughing quite a lot, but hadn't had to resort to antibiotics or Ventolin, hadn't been diagnosed with asthma or anything like that. They were trying to avoid cow's milk products and bananas, and also just history, family medical history. Mother had kind of chronic sinus problems as well. So again, I diagnosed it was a lung pattern. There was weakness it was easier to tell that there was weakness in the lung area and the spleen area on the abdomen. Skin was quite moist, so that was something to take notice of. And also I was able to diagnose both also on the pulse a little bit and also on the abdomen that it was a lung secondary liver pattern on the controlling cycle. And I did very light treatment using a silvertation and found that excess stomach, we usually treat the low points. I did stomach 40. So in this situation, again, I had to think about what do I do with my shonishin, because when there's eczema, we don't do stroking because that can often exacerbate the eczema. So I was thinking about, well, what can I do? And I just did some very light tapping. She was quite tight in the shoulder area, relaxed the upper back and occiput area, and just did some very light tapping around the patch of the eczema, not over it. And again, just did some just general light tapping or stroking around the abdomen is very helpful for digestive problems. And again, left a Presspherium on GV12. So toddler, lots of change going on. She'd started walking a lot more. She was teething. Her sleep was better. Bowels had improved. She was going 2 to 3 times a day, but the eczema had got slightly worse, although it wasn't bothering her. So I did the same root treatment pattern, but this time I just avoided tapping even around the eczema because I thought, it's obviously exacerbated things. And instead I just did some very light tapping around sort of some other obvious points that are used in Japanese acupuncture for skin conditions, but also obviously can clear heat, large intestine 11, 10, 4, bladder 40. So just areas where there wasn't eczema. Very, very light. And when I say tapping, I'm literally sort of talking about very light tapping just for, a few seconds, not for very long. So I needed to do more treatment with this toddler. I treated her about 8 times. Got the mum after a little while to do some home therapy, but being careful that she literally just did some tapping on a couple of the points that I had told her that she could do. There was a lot of change going on, so obviously we know that that can cause a lot of disruption. Babies, when they're teething, they start getting temperatures, things change. I think at one point when the bowels kind of got worse again, just did very, very light in-out needling. So literally just tap the needle in, and it's a tiny, tiny needle. It's a 0.01 needle that we use. So it's so tiny that, you know, you definitely have to have a guide tube in, out on those points. Generally, the eczema cleared up, was much reduced on the shoulders, and the follow-up 9 months later, the eczema had mostly cleared and the bowels were regular. So I needed to kind of do more treatment on her, but again, had to be careful about what I did, because some things like actually doing some tapping even around the eczema felt like it potentially exacerbated it. So treating young children up to the age of 5, we can just do Toyohari or Toyohari and very light kind of meridian therapy. The key things really to bear in mind are you have to make the child feel very relaxed. A lot of, if you've worked with children yourself, or you've been to other people who've taught stuff about pediatrics, they'll tell you that the most important thing, not only about what you do, is how you do it and how you interact both with the child and the parents in the treatment room. And that can be kind of quite complicated as well. But most important thing is that you keep it playful, you keep it light. I often give them tools to play with. I say, oh, this is a magic, you know, if they're a little bit older, I say, oh, would you like a magic wand? Or, you know, here's a tool that they can have, or they can start chewing on a metal tool in their mouths if they're teething, for example. But being very, very flexible and constantly checking skin quality, that you're not overdoing treatment. And the most important thing is you don't do anything that causes pain. So I do sometimes in older children do direct moxa, but you have to be super, super careful, because if that child feels even the heat of that moxa as a slight burning sensation, that is it. They will probably not only never let you do moxa again, but they may not let you go anywhere near them again. So you've got to be super vigilant about those things. And even like, for example, when you want to say needle a point, and you want to do it maybe with the retractable Taitian, and you've got a toddler who's moving around all the time, and you know, you're trying to do something like lung 9 and they're moving their arm around. Don't try and restrain them. You know, go to a different point, go to spleen 3 or the next point that you're going to need, and then come back to that when it's free. So be really, really flexible, and basically it's the path of least resistance, because if you create any kind of extra tension, any disturbance, that's going to disturb the chi, and that's going to cause more disturbance to the chi system rather than better. So if they can come out of your treatment room, you know, laughing, smiling, or like, you know, if they're a bit older and they're like looking forward to going back for more. My son used to call it tap tap. He'd often wake me up in the middle of the night, usually at lung time, because he's a lung pattern, and he'd be like all a bit coldy and a bit snuffly. He's now 17. He still sometimes asks for treatment, amazingly. And he would sort of say, I need tap tap. And it would be like, yes, you know, I don't care if it's 3 o'clock in the morning. If it means I can give him a treatment and he'll go to school the next day and won't disrupt the rest of the day, then that's great. And that's often what I did, you know, in the middle of the night, give him a treatment, a little light treatment. So it's really important to keep it light, keep it playful. And that's going to just help also ease things in terms of their kind of recovery. Age 5 to teenage years, I mean, there's a nice little sort of, it's just a kind of guide really. It's not to be taken too kind of prescriptively, but one of our teachers, senior teacher in Toyohari Association, talked about with newborns, you're looking at 1/10 to 1/7 of the amount of treatment that you would do for an adult. And he interestingly talked about even up to the age of 20, you may only be doing 2/3 of treatment. So these are just an idea of how much you might do at the different ages. It's described that really by age 10, the function of the 5 organs will be complete. Chi and blood runs smoothly through the body. You know, you can start doing much clearer differential diagnosis in older children. So you can incrementally increase what you do at the different stages. With teenagers, I've got one myself who's 17, oh joy. I love this quote, it's from a book that's sitting on my bookshelf, you might have read it. Get out of my life, but first take me and Alex into town. So obviously we can think about this as, children are changing all the time, but as we know, teenage years are a time of huge change, hormonally, big physical changes going on around puberty, that whole transitioning into adulthood, feeling more responsibility, certainly with school and school pressures these days, exams. Maybe they're studying more, not having enough exercise, having too sedentary a lifestyle. Hamid talked this morning about the effect of too much screen time, which as parents we're constantly grappling with, not only for ourselves but also our children. Just that whole thing of forming intimate relationships for the first time outside the family, their identity, who they are, finding themselves. It's often just a really awkward time, isn't it? You might remember it from your own experience. You just kind of just don't feel right sometimes in your body. And it can be quite difficult to treat teenagers, in my experience sometimes, partly also because up to the age of 16, parents are expected to be in the room. Legally, they're required to be. So then you've got children who, maybe are awkward with their parents in the room. Maybe it's harder for them to talk to you, or maybe there's some kind of dynamic going on between the parent and the child that's kind of coming into the treatment room. So that whole kind of thing of how you develop sort of trust with them, and starting to build a rapport. And certainly, maybe somebody can throw light on what this actually is, but if you do feel abdomens, have you ever felt the abdomen of a teenager? It's like a rock. It's solid rock. So trying to do any kind of differential diagnosis can be really quite tricky, and it may be, they might be just working out, but actually there's just a lot of tension there. So doing abdominal diagnosis is quite tricky, but you can still feel the skin and the quality of the skin. So going on, Gail, you were sort of going to ask. Here's a nice example of somebody who's kind of going into that sort of teenage phase where usually around that time I wouldn't really be thinking about doing Shonishin. I'm thinking more about doing regular acupuncture, maybe with a Teishin, maybe very, very light treatment. Certainly they can be very jumpy, very nervous. But I probably wouldn't be doing Shonishin. But this young man who came for treatment, actually it was usually his dad who brought him, had quite serious behavioural issues. He was kind of being looked after by some sort of team of kind of multidisciplinary practitioners who were sort of working with him in school and out of school. He was actually still in mainstream school. But only just. He could often be quite violent, quite aggressive, not actually in the treatment room. He was actually always quite kind of personable, but certainly, his father would describe quite kind of openly in front of him how he was, just generally often at school and even at home. Could be quite disruptive, could throw things around, smash things up. Very tense abdomen, very tight and thin pulse, weaker on the left side, which indicates a kind of more what we call a liver pattern, liver and kidney being weak on the left. And so I just felt that actually I really needed to go back to Shonishin, almost treat him a little bit kind of like a baby in terms of dose of treatment, because he was very nervy, almost didn't kind of, said, I'm definitely not having any needles. And I just did some very, very light stroking, did some points that are very much about kind of calming and just really relaxing the area around the upper back and neck area, having very kind of calming effect. And then just doing very light meridian therapy using a Teishin on liver, primary pattern, and secondary lung. So he responded really well, but actually I really had to keep kind of treatment quite short with him. And again, I basically did a lot of just very light Shonishin and never really even progressed to using regular needles. I still had to use Teishin, because every time he said, what tools are you using? Are you going to use a needle on me? So I had to be very kind of careful. So I realise we've got a lot to cover. We've got 20 minutes. So pregnancy, again, another time of big change, changing all the time during that 9-month period, both as well as lots of physical changes, but also a lot of mental, emotional changes, and certainly a lot of changes in relation to identity, and suddenly thinking about, some being a parent and bringing up things about how they were parented, and all sorts of kind of anxieties kind of come up. In relation to the trimesters, obviously, those who treat pregnant women, first trimester, very light needling, usually focusing more just on root treatment. Obviously, if somebody's got things like morning sickness, then we're going to address that. But generally, really strengthening the chi and the blood, supporting, balancing the meridian system. And also, obviously, anybody, if they've had miscarriages or they're frightened of miscarriage, then working with anxiety and just calming the whole sort of system. In the second trimester, women generally more robust, not always, but certainly those who are, you can do more. And this is where, you know, there may be quite a lot of different symptoms that come in relation to things like backache. I mean, I would do low back treatment, even in this stage of pregnancy, because I'm doing very, very light, non-dirty needling. So it's actually just incredibly light treatment. Pelvic girdle pain, blood pressure, the whole gamut of things that can come up during the mid trimester, but certainly possibility of doing more treatment then. Third trimester, again, going back to doing quite a lot of emotional support in preparation for this big kind of life change, starting to get more circulation going into the lower burner. And certainly in my experience, I don't know about you, but the people the treatments that I really enjoy giving least of all are people who are just like coming literally 2 days before they're about to be induced, who you haven't seen, you've got no relationship with them. Often they're not actually that responsive to treatment, as in even in those times I will do more insertive needling, and they don't feel very much often. It's quite interesting, whereas the patients that you've worked with, who you've treated during their pregnancy, usually a lot more sort of receptive. So this case study, she's actually the mum of the baby that I treated, that I showed you in the first sort of the case study. And as I say, I treated her before both of her pregnancies. She did get pregnant quite quickly, so she clearly didn't have big fertility issues, and then also treated her postnatally. And so actually her pattern stayed pretty much consistent with how she was before her pregnancy. And my root treatment was supported by just doing some moxa, strengthening stomach 36, bladder 17, 18, 20, just very light moxa on those points. We also use the 8 extra vessels using zinc and copper pellets. And that's literally putting zinc and copper pellets on the skin, seeing pulse changes, and also symptoms change. And basing the choice of which extra vessels to use on which either meridians are affected or which areas they influence. So I did kidney 6, lung 7, supporting her during that kind of first trimester also because, as often happens, there's kind of constipation. Mainly treating her with a liver pattern, but then treating her on switching to spleen one time, secondary liver, after she'd had a sickness bug. So having to adjust, but really just doing root treatment. She developed these broken blood vessels in the middle of her second sort of trimester. I'd certainly had experience of doing very, very light bloodletting on what's called vascular spiders, tiny little purple vesicles. They're not veins, they're tiny little blood things. And certainly I remember one patient in particular who literally could hardly stand up in a queue at the supermarket because she had such bad broken vessels that it was so heavy and so achy. And I remember just doing very, very light bloodletting, a couple of vascular spiders, and she was just much, much lighter, much able to be able to move around. So this was literally straight after, like within a minute. So I did down here a couple of their vascular spiders, and that's how it was. And it was like super, super dramatic. However, it was back by the next day, and she said it felt a little bit hot in the area. And I saw her about a month later, and the varicosities had basically just continued to kind of spread a little bit. So they weren't getting any better. She also had vulval varicosities, and I just thought, not sure I want to bloodlet again, because even though I had this amazing reaction, actually it didn't last, and it kind of kept continuing as she was getting heavier to sort of get worse. So I basically went back to my root treatment and then did the Kike, the zinc and copper, on So we also use it on the additional 4 channels that are not the 8 extras. So that's like a liver and heart pattern, and large intestine, stomach for Yang Ming. And so I chose the liver-heart pattern because of where the liver channel runs around the vulva area, and I've used it before on people, and it's been incredibly successful. Just very, very light zinc and copper with a little bit of moxa to reinforce it. I needled spleen 10, again, very lightly, no dirty needling, just literally popping the needle in. There's a moxa treatment I haven't got time to go into now that's for spleen 6. It's a direct moxa treatment that is treated all the way through pregnancy as a way of nourishing both the fetus and also preparing body for labour. And it's used from the 5th month of pregnancy onwards, incrementally increasing the number of cones per month. Generally speaking, just very quickly, she responded much better to that than she did to the vascular spider treatment. And so, again, doing lighter treatment worked more effectively on her. Menopause. So these are really just, again, I'm not, as I said right at the beginning, telling you how to treat during these phases, but just thinking about how you can adjust what you do. And certainly those of you who are there or nearly there or through the other side know that menopause is a time of huge change, and it doesn't just kind of happen, you know, it can happen for years and years and years. Perimenopause can go on for up to 7 years. Menopause is identified once there's been 1 year without menstruation. A lot of physiological changes manifesting in either psychological changes, things related to temperature, for example, very classically, hot flashes, night sweats, palpitations, big imbalances between yin and yang, counterflow, qi reactions, very hot below, cold feet, that kind of thing. Reduced libido, lots of dryness, just that whole also impact on the yin, and as I say, imbalance between yin and yang. Women being seen as particularly yin in their physiology, menstrual cycle every month, the production of blood, building of babies, all very kind of yin type activity. And then obviously just seeing those kind of changes at that time. So there's a lot to be said about, you know, again, that whole thing of how we adjust to that, you know, depending on, you often hear women saying, oh, around this kind of time, I just feel invisible, you know, I just kind of like, I'm not kind of even recognized by society, and very different to what Hamid was talking about earlier today about how women in certain societies are either sort of seen as being the elders of society, or they're certainly integrated into the family. And certainly in Japan, you often get sets of things like miso soup bowls or anything in sets of 5, and it's like the family of 4 plus the grandmother who lives with the family. So it's kind of people are kind of much more integrated, and all these things, you know, it's interesting. You look at somebody anthropologically of how that impacts on how somebody is in terms of menopause. So I think it's really important to, again, I mean, we focus on root treatment. Very often we're talking about a kidney or a liver pattern, and the secondary pattern often relates to the spleen and the heart, relating specifically to the symptoms that people might manifest. In terms of choice of points, we may use counterflow qi points. Nanjing 68 says the Hersey water points are particularly good on the yin channels for bringing down that counterflow qi type reaction, so working on that water-fire imbalance, and working very much on these juncture points of the neck and the abdomen, where the meridians either are coming up from the legs into the abdomen, or also from the head into the torso where the organs are. So these are kind of key juncture points that we can work on. Branch treatment, again, using these Kike polarity agents, possibly on kidney 6, lung 7, can be really helpful for the hot flushes, or also liver-heart pattern for particularly things like anxiety and sleep. How much time have I got? Okay, 10 minutes. So so this is a perimenopause. Guess what I'm showing in these two cases, somebody who's actually 52 who is older than the next case, which was a menopause case. And somebody who generally, although she's been having perimenopausal symptoms for a couple of years and hadn't had a period for 3 months, generally in terms of how she was in herself, she was actually kind of seemed kind of quite robust, quite strong. There was some weakness in the lower belly area. But I would say that overall her chi was kind of quite strong, and her she reacted very kind of well to treatment and quite quickly, and I treated her about 4 times, something like that. And the one time that she reacted badly was when I then started doing more treatment on the back, and she kind of suddenly, her mood crashed and she had some more anxiety, and I just decided I needed to pull right back and do kind of quite simple tonification, mainly tonification with some dispersion treatment on the yang channels. Compared to the next person, who was actually 50, had already been in menopause for a year, had a lot more symptoms, and just presented as a lot more depleted. She had darkness under her eyes, she had poor luster, she was just very, very stressed. Her pulse was quite a lot weaker, and I initially treated her as a kidney pattern, using these counterflow chi points, but again, not much change. So in that sense, I kind of reevaluated what I did, and actually it was more, I thought, to do with which pattern she was, rather than too much or too little treatment. And she responded, got much better on treating her as a liver pattern. Again, just doing some quite light oku moxa on the back, which doesn't create heat in the body, but actually, again, works on regulating the chi and the blood. Particularly effective when I did it on bladder 17, 18, and 20, the 6 flowers. So kept treatment very light with her, and interestingly, when she was on holiday, all her symptoms would get much less, so that kind of certainly indicated that she responded. She was obviously, stress was a big component in her symptoms. I'm not going to go into this in any detail. It's just a little kind of overview that shows how all of the different Zhang Fu start to deplete in the different ages. But one thing that's kind of just important is this idea of what happens, that we get stiffer, things get kind of more brittle, and that what we need to do is try and ease things at that stage. And it may be that we can feel that even the skin, particularly around the neck, gets that kind of very tight thing, and we just need to do some very light tonification, what we call kind of contact needling around this area. And that if a person, basically the patient would be sensitive to needle when the muscles are stiff and the skin is thin. So again, adjusting how much we do with elderly patients. However healthy somebody looks, we know that all the functions of the body are starting to kind of decrease in terms of how well they're functioning. The chi and blood are both weakening, and sometimes you get these very strong pulses, but that can also be because there's blood stasis. So the extreme version of that is somebody who has sort of arteriosclerosis, and they've got these very hard kind of pulses that actually are very, very difficult to soften in the course of treatment. But basically, again, I think treatment you need to kind of work slowly and gradually and not do too much too quickly. And certainly I've had a 98-year-old woman who seemed much stronger than some of my younger patients. But I think that overall, you need to kind of think about just generally incrementally building up treatment. I haven't really got time to go through the last case, but something to just think about, particularly direct moxa, is really, really good as tonification. That's a poet, a haiku poet from 300 years ago, said, "Don't travel with a person who neglects applying moxibustion on the leg point, stomach 36. I would recommend you all doing it in your own practice on yourselves. It's a great way of strengthening your own immunity. But just generally, sometimes even something like stomach 36, those of you who know about the Mox Africa project and what they've managed to do in terms of TB, incredibly powerful what you can just do with 1 point, something like stomach 36. So I tend to use moxa quite a lot. And unlike using stick moxa or using moxa box, when you're using direct moxa cones, it's not about creating heat. So you're working very much on either sometimes treating blood stasis, you can talk about actually doing tonification treatment, but just generally you can really adjust what you do, even doing the moxa. So I say I've got, this will go all, I think, up there, so I'm not going to go into the details of the case, sadly. But just by way of summary, I was demonstrating a kind of step-by-step approach to treatment, but obviously you can kind of think about how you can still implement that step-by-step approach in terms of what you do. You know, when you've needled certain points, before you start doing something else, think about feeling the skin, feeling the pulse. Has it improved enough that you think, actually, maybe I don't need to do anything more, and that's enough. And just thinking about what we've talked about through these different kind of periods and stages of life, can also just be other changes. Somebody who's had a bereavement, somebody who's lost their job, they've had a divorce, a separation, they're moving house. Big times of change where people are going to be maybe more sensitive, more stressed, their whole energy system is just needs maybe much less treatment. And just to remember that actually what are we doing as acupuncturists? We're regulating qi. So all the time what we need to do is be trying to balance the yin and yang, balance excess and deficiency, and just generally make our patients feel more at ease rather than dis-ease. And the importance of paying attention to dose in whatever style of acupuncture you do. So I'll leave you with a nice little quote from Maya Angelou, and if you've got a couple of questions, maybe we can do that. Also a little plug for forthcoming courses. Shonishin is happening on February to March, one weekend. Planning a moxibustion, few weekends actually, with some, that says internally, it's supposed to say internationally renowned moxibustion specialists. And the Toyohari program, which is going to run again from January 2021, which is an 8-weekend program. Okay, so thank you. And bit of a whistle-stop tour. Any quick questions before we finish? Might have a couple of questions. Total silence. Yes, Magda.
Can I ask about the zinc and copper
Yes,
treatment?
yeah. It's part of Toyohari, so it's kind of taught very much within Toyohari program. Those of you who maybe came to hear my talk 2 years ago, I think I can't remember the exact title of it, but it was about how all the different ways that we can influence qi. And Japanese acupuncture uses lots of polarity agents. So it's sort of drawing on kind of you know, sometimes sort of kind of quite Western medical concepts of negative and positive polarity, like with ion pumping cords. But literally, when you're using zinc and copper pellets, you're putting them on either the extraordinary vessel points or these additional points, and you have to palpate and learn how to kind of find those points. But basically, as soon as you put those pellets on, the pulse improves if you've got the right combination in the right way round. So that's your first indicator, has the pulse improved? And then sometimes maybe the symptoms improve there and then, like somebody's neck, maybe you put it on and the neck moves easier on a Yang Wei Dai Mai pattern, for example. And then we reinforce it with moxa in certain combination of points, direct moxa on it. So it's a very, very light, but it's called branch treatment because you use it to address symptoms within particular channels.
Do you leave the pellets on?
For about 2 minutes maximum, not for very long. And then you take them off and then you do the moxa. Yeah.
And could I ask,
Yeah.
you use the salt bath for?
Again, it's just a really simple thing that people can do at home to just soak their feet in salt. It actually helps to draw energy down. So it's a kind of really nice calming treatment and can help with things like hot flushes. Just like things like Epsom salts or regular, like nice bath salt, Himalayan salts, that sort of thing. And not too hot, not too hot water. Warm, but warmer more than just tepid, but not hot, not uncomfortable. So it should be pleasantly warm and very relaxing. Sorry? Yes, you could have all had it. Yes, I know. Anything else before we finish? Tea time. So a bit of a whistle-stop tour, but it's more really about just getting you to think about how you can take this back to your own practice and just maybe tweak little things that you do to adjust and hopefully get the right amount of treatment for your patients. So thank you for listening. Nice to meet you. Okay, bye.